concentration of the iodine is this, and all over the thyroid gland the concentration of iodine is like this. Then what do you mean by that? It means the cells that is growing within the node is hyperactive. So they need more iodine. So this is hyperactive nodule. So this hyperactive nodule will release too much T3 and T4. Patient will have hyperthyroidism. Okay? If you see, this is a mass too, but it's totally empty. We call it cold nodule, and this would be heart nodule, and this is cold nodule. Okay, so now this is radionucleotide. I give you the explanation how does it work. And number B is fine needle aspiration. Other method they said, also known as biopsy, fine needle aspiration. It is, they do it either ultrasound guided or blindly without ultrasound guided. They, in aseptic precautions, they stick with the needle 3-4 times to take the fluid out. Fluid comes with the cells. Then they check it up and they send for the laboratory. So that fine needle aspiration to see the mass is benign or malignant in nature. Okay, it is one of the good method to isolate, to differentiate, to understand the mass is what nature of the mass. Is it a simple cystic fluid, or it is a solid tumor, or it is a malignant, or it is an abscess. It is an abscess. And another one you need to add called elastography. Elastography. This is a new technology. Elastography can determine a mass is benign in nature, benign or malignant. What does the elastography do? Elastography is the mechanism to understand that how the sound beam is interacting with the tissue inside the thyroid gland. So now understand, let me show you, let me discuss about the elastography. Elastography. See, look at here. Elasto means elasticity. elasticity, compressibility, stiffness, okay, all depends on the density and tissue characters. Density and the tissue characters of the mass. Now understand, so this is a thyroid gland, and thyroid gland has, this is a mass and this is a nice mass. You did the sonography, you saw these are irregular border, looks different, even the you might see some posterior shadow, but this one is smooth, contour, round, homogeneous. It doesn't have any problem, doesn't look bad, but it looks bad. So now this is your ultrasound transducer. Transducer is sending the beam. Transducer is sending the beam. Definitely, this sound beam will have an interaction. Interaction means the conversation. That this tissue will say, hey, who are you? Are you trying to pass through me? Then it says, it's not easy. I will resist you to pass through me. Why? I am different than this. Say if you put A and B. My tissue density and the tissue characteristics are elasticity, compressibility, stiffness. I am different than B. I will interact with you differently than B. B will say, oh, I am benign in nature. So you want to pass through me? Okay, pass through me. I'm not going to bother you, but it will bother you. So when the beam is coming down, so it is a sound wave, right? Am I right? That sound wave is trying to pass through this tissue. The tissue is harder, dense. So then it will, when the sound wave will pass through this mass, that mass will be shaken, or waves, compression and rarefaction, remember the acoustic variables? It will be different than when sound will be passing through this normal thyroid gland or passing through this benign in nature tissue. Definitely it would be too different. Called stress and strain. Under the pressure, under the sound wave force, how much it will be deformed depends on the tissue characteristics. Definitely malignant tissue has a different character than the benign. So now, sonographically, when you do the elastography, then you will see, let me show you, if the normal tissues are blue color, I'm just giving the idea. Normal tissue will take the blue color and the benign will take the blue color too. Then at the same time, you will see this mass is taking different color. It is taking different color. Why different color? Because this tissue is different. And the sonographer, he or she knows by their experience and in the textbook that when the tissue is characteristics is malignant in nature, it will show you the different color than all others. And statistically they proved that they did some 50,000 cases, and all of them, those who are malignant in nature, it shows the green color. I'm just giving the idea. It shows the green color, and all other will be purple color. And if you get the green color of this, so then according to the statistics, you will see, oh okay, I feel like it is malignant in nature. So you don't need to do the biopsy. You can simply take it off.
Is this new?
Yes. You don't need biopsies. They said 97-98% sensitivity that it can correctly prove that this is a malignant. 96, 97, 98%. So then they said, then why do I need to do the biopsy? You know, biopsy is scary. They punctured couple of times, and sometimes you see the thyroid tissue is not coming, some other fibrous fatty tissue is coming. So then after 15 days they will do it again. Patient says, no, I don't want that. There's a lot of complications. If bleeding starts, it is dangerous and it's scary.
Does that work everywhere or just here?
No, I mean not every hospital they do that.
In the body, just on the thyroid.
No,
or
not on the thyroid. Now do in the breast.
Mm.
Now do on the
Superficial.
Not only superficial, they're doing the liver too.
Oh.
So it's how nice this elastography. So in elastography, sound beam will determine that this is density is different than normal tissue. That's why under stress, the elastic tissue will be compressed differently than this benign. That is called stress and strain test, and it will create the shear waves. Shear wave means while the beam is passing through this tissue, its tissue's characteristic is different, so the sound wave will be different too, and the machine will catch it. And it will display different color. And statistically it is the formulated. If it shows this color, that is malignant. Okay, so I'm gonna stop here today. Final aspiration, then we will go sonographic technique and appearance next time. I'm going very details for you, because once you're going to learn, you can apply this for other organs, other superficial organs. It will help a lot for the breast. We do the same thing for the breast. Okay, so I will continue on the thyroid and parathyroid glands next time, and it is a very details lecture in order to understand the anatomy, physiology, and sonographic techniques, other modalities, and you will see I'm going to discuss about all pathologies nicely and the sonographic appearance and everything. Okay, thank you very much for paying attention, and keep watching, and make sure don't forget to view my website, that is Dr. Ayub lectures.com. Okay, this is the website, my personal website, and you can take membership if you like it. This website has a lot of lectures on the physics and vascular, and there are some protocols videos, and so if you want to get a good preparation for the SPI, so you can watch it. Okay, thank you very much for paying attention. Bye.